Hey everyone, my name is Dr. Gayla Tia Strong. I'm a physical therapist who got a 100% on my NPTE, and this led me to co-found SPT with Me, which is an online NPTE prep platform. If you're studying for the NPTE, check out our courses at sptwithme.com. Now, for what you're actually here for, let's talk about how to properly study for the cranial nerves. Whenever you hear the words cranial nerves, it wouldn't surprise me if this image were the very first thing that popped into your head, or at least an image similar. An anterior to posterior view of the brainstem plus the thalamus. Of course, this is a very important diagram to have down and memorized. However, I just want you to understand that if you really want to understand the topic of cranial nerves as a whole without having any questions remaining after you study, using this picture only does not give the full image. So there are a few things that I mean by this. First is obviously that these little spaghetti noodles that you see coming out of the brainstem, it doesn't really look like this in a human body. These little spaghetti noodles are cut purely for the sake of making this image a lot clearer in order to show you where the nerves exit the brainstem when they do. So whether they exit at the pons, the midbrain, the pontomedullary junction, the medulla, etc. Secondly, given that this is a two-dimensional image, you cannot really see where exactly all of these nerves come out of and the actual direction that they head towards. For example, cranial nerve 2, the optic nerve. It almost looks like in this image that it goes into the brainstem where the optic chiasm is coming out. However, if you were to look from a different point of view, you're going to see that this definitely does not occur. Other nerves might actually exit out of the posterior aspect of the brainstem. However, again, on this image, it looks like it's just coming out of the side. So what I'm trying to say is it's always important to have multiple angles of a three-dimensional structure to be able to fully grasp what is going on. So to give an example, this is a posterior to anterior view of the same exact structure, the brainstem plus the thalamus. It's the backside, right? If you look at cranial nerve 4, the trochlear nerve, you will actually see that it exits the posterior aspect of the brainstem. However, from the image prior, you can't see this. It almost looks like it just kind of exits laterally. However, clearly from this angle and this plane, you see that it exits posteriorly. Once again, this is the same structure, the thalamus and the brainstem. It's a lateral view, left side being the anterior side while the right side is the posterior side. Here, you get to see the orientation a little bit better of how these nerves actually exit, whether it's ventrolaterally, superiorly, posteriorly, or if they're wrapping around certain structures. So having multiple images, different planes, this can really help you orient yourself of how these nerves travel. So there's actually a lot of information that you can also get from seeing images such as this. First off, you can see how the structure of the thalamus and the brainstem actually fit into your body. It's not just this floating independent structure like the previous images were suggesting. So this will actually help you understand the orientation. Secondly, what this image also helps show is that the little spaghetti noodles, the nerves that are coming out of the brainstem, understand that this is not actually where these nerves start. They all have a nucleus. Some have a nuclei. What I mean by that is multiple centers of where the nerve actually starts. They do not just start where they exit the brainstem. They start within the brainstem, and then they exit as nerves. Then lastly, you get to see that when these nerves do exit the brainstem, they are not just severed or cut like the previous images were showing. They actually have a continuation and make their way to their destination ultimately. So whenever you're studying the cranial nerves, it can be challenging when you don't have all the information because you're kind of just guessing, like where does it go? Where does it start from? Does the nerve itself travel superiorly or inferiorly? Does their nucleus or nuclei, does it begin on the same plane as where the nerve exits? Or maybe from the nuclei, it actually has to descend or ascend until it reaches its exit point in the brainstem. Now, I will say there's definitely a good handful of cranial nerves that are a bit harder to memorize than others because they just have a lot going on. They have motor innervations, sensory input, special sensory inputs, and things like that. If you do not have a picture to show you where all of these different routes and pathways are occurring within that single cranial nerve, it's going to be really hard to memorize something. So what I'm trying to say is use as many images as you possibly can to help you with your studies for the cranial nerves. Hopefully this gave you a good guideline on how to start studying for the cranial nerves. If you enjoy what you saw, check us out at sptwithme.com when you're studying for the NPTE.